This time I want to explain two tips for enhancing hype effect. These tips are usually for uterine myoma and uterine adenomyosis. So, am I right place? Not for pancreas. First, I want to explain about sonazoid. This sonazoid is ultra contrast enhancing agent. Usually, it is used for diagnostic purpose, but in this time, I want to explain about therapeutic purpose. Think about the hypoaction. First is heat. This heat make coagulation necrosis and cavitation. Cavitation make cell membrane damage, and this presentation, we want to focus on cavitation effect. Contrast enhanced ultrasound is usually micro air bubble. If this air bubble exposure to a hyperfocus, this micro air bubble suddenly burst, and this air bubble burst make cell membrane damage. So if we use CEUS, and this CEUS make more cavitation effect. But why Sonajoid? Why not Sonovio? We are familiar with Sonovio. Sonovio is a long history drug. Sonovio, this Sonovio is first good long and disappears quickly. But Sonajoid is invented for detecting hepatocellular carcinoma. So this Sonajoid first go liver Cooper cell and then long. So this remain in the body for a long time. So in my experience, if I use Sonazoid, I can enjoy the high effect. Enhancing effect was about 2 hours. 2 hours is very enough time for enhancing high effect. In this article, we compared Sonazoid with a hyper-only case. This article is for treating uterine fibroid, and this article will definitely reduce sonication time and sonication power. So this Sonazoid is very effective to reduce hyperenergy. For use, for practical use, for yes, absolutely. Completely safe time was 30 minutes after the injection. When about 15 minutes is a relatively safe time, and in my experience, when I used the sonication after 10 minutes or 5 minutes, and that time, sometimes I could see pseudo MGSC. So at least we sonication after 15 minutes. For treating uterine myoma or adenomyosis, 15 minutes is safe and good time. But when I treat breast cancer or breast fibroid, breast region is too close to skin, so I usually obey the 30 minutes. And sonication power is usually 100 watt to 250 watt. And this sonication power is very enough to ablation the uterine myoma and fibroid. Now for pancreatic cancer, I use the sonication power usually 80 watt to 150 watt. Let's think about the low temperature hype. If we use sonazoid, we make more cavitation, and we could reduce power and time. This means we could treat with low temperature. We treat with low temperature, we could reduce complication, and we could make the protocol more simplified. For example, when we treat uterine fibroid, we don't need heart preparation or we don't need skin preparation. And think about immunogenicity. When we treat with hyperthermic ablation, usually almost protein will be denatured, and this make more reduce the amount of injected anti-tumor antigen. And we think about the cryoablation. This is freeze the tumor, and this make more intact protein and more make anti-tumor antigen. But this cryo make sometimes make a cytokine storm, sometimes patient make dangerous. So, when we use sonazoid and make lower temperature height, it could be not too hot, not too cold. It could treat with warm. So this make more protein. This make more tumor antigen, and usually less possibility to make cytokine storm. So this could be very good for cancer treatment. I want to show the one case. This case is ovarian cancer, metastasis to liver, everywhere in the body. First, in this situation, these patients cannot treat with chemotherapy because drug resistance. So in this time, she treat with only HIPE. And first, I want to treat this segment poor lesion. This lesion invade to lip and make severe pain. So I treat this segment poor lesion, and this lateral is actually big and so some part are too deep. So superficially I treated, but 1 month later, the all tumors are rapidly shrinked. And interesting part was neck lymph node. I didn't treat this neck lymph node.
Thank you for your very nice lecture. 林婉娥教授啊，从如何在子宫肌瘤中确认它是良性的，我们从生长速度、它的血供、它的直径、它的年龄、它的穿脱青霉等等，包括它的核磁超声，可以辨别出哪些子宫肌瘤会有恶变，也介绍了他的一些经验。Thank you, thank you very much.
To readjust our audio, please wait. 不好意思，大家，我们在找那个工作人员调整一下我们的音频啊，
She's president of
大家稍等一下。
Mosaic branch of Guangxi Lizo Maternal and Child Health Hospital. Chief physician, doctor of medicine, doctor of Chongqing Medical University, young reviewer of British Journal of Obstetrics and Gynecology, is the president of the Young and Middle Age Committee of the Minimally Invasive and Non-Invasive Committee of the Chinese Medical Doctor Association. She is chairman of Young and Middle Age Committee of Minimally Invasive Medicine branch of Guangxi Medical Association, standing member of the Promotion Committee of Non-Invasive Focused Ultrasound Technology, and a standing member of the Focused Ultrasound Committee of the National Alliance for Technological Innovation of Minimally Invasive and Cancer Treatment Industry. Okay, come on. Thank you.
Please go ahead, please.
Yeah. Let's see this lymph node, this neck lymph node. I didn't treat this lymph node. This lymph node size was 36 millimeter, and I didn't treat this lymph node, but 1 month later, rapidly shrinking to 23 millimeters. So this is, for example, of systemic immune effect. So low temperature, high make systemic immune reaction. The solution power is 150 watt. Yeah, so I think the low temperature, high and immunogenicity is worthwhile to study. And next tip is using rectal poly. you are familiar with this kind of polycatheter. This polycatheter is usually put into the bladder and inflate this balloon. But in this time, I want to explain this polycatheter into the rectum. Sometimes when we treat uterine fibroid adenomyosis, we face the difficult case when uterus is retrograded and when the region is posterior wall, and this case is very hard to treat. And sometimes this region is beyond the therapeutic length, and in this case we cannot treat. But when insert polycatheter into the rectum and inflate the balloon, this balloon press the uterus, and this uterus changes to anterograde. And so, this using polyrectal catheter inflate the balloon make the therapeutic distance. So we change it, the position is very easy to treatment with HIPE. And this article, we try to treat the region beyond the therapeutic distance. And in this article, we successfully treated these regions. And besides the therapeutic distance, there is some more benefit. When uterus is located posteriorly, and this situation, much part of small bowel are located anteriorly, and sometimes push away this small bowel is very difficult and need much blood infiltration. This make patient difficult, and this make operator difficult. But we insert polycatheter and balloon infiltration, and this make the push down uterus and fix the uterus in the posteriorly. Make a fixed uterus is very benefit to treatment. And this situation, this is very easy to push away small bowel and not so much need blood infiltration. And another benefit is mechanical contraction of the uterus. When we treat uterus, we usually inflate the bladder and use water balloon and abdominal wall. And these two, more one balloon in rectal polycatheter balloon, think about this three direction water balloon contraction uterus. So if with this three balloon, we could screen uterine myoma and make reduce vascularity, and we could reduce suffocation energy. For use, usually I use three balloons. First time I used one balloon, but if I will use one balloon, this is easy to move back from original position. So I put two balloons. These two balloons make some barricade. And so these two balloons make peaks. And this balloon, one balloon, if we put one balloon beyond the superior rectal valve, this is much better. And inflation amount is usually 50 cc. Sometimes I inflate with 60 cc, but sometimes this 60 cc is easy to burst. So I usually use 50 cc. This is a very enough amount and stable amount. For using inflated balloon, first rectum, this balloon, and then bladder. If you first inflation bladder, this make hard to push down. So first rectum and then bladder. I want to show one case. This case uterine myoma is very, each case. 5.6 centimeter, and this is quite optimal size and easy size. So in this case, I want treat with extremely low power. See, this is image. I put rectal catheter and inflated balloon, and these three balloons fixing the myoma and fix the myoma position. And so I could easily push away bowel. I could easily squeeze myoma. And this case I treat with 50 watt. 50 watt is quite low power, so I treat with 460 seconds. And the next day, in CEUS view, I could treat clearly. So I want to recommend use with sonazoid and rectal catheter and challenge with low power high. So thank you.